about a disease in cats called feline idiopathic cystitis. So there's a group of urinary tract diseases in cats called feline lower urinary tract disease, and this is kind of an umbrella term for all the different causes of lower urinary tract disease signs in cats, such as straining to urinate, bloody urination, painful urination, and urinating outside the box. Idiopathic cystitis is the most common cause of these signs in cats. However, it is a diagnosis of exclusion. So that means we have to rule out all the other causes of these signs before we can say it's feline idiopathic cystitis, or FIC. So tests that usually are recommended to be run are urinalysis to look for bacteria and crystals. If bacteria is seen, a urine culture and sensitivity should be run. However, it's important not to assume that a urinary tract infection or UTI is the cause of your cat signs, because UTIs are extremely rare in young to middle-aged cats. In fact, it's been proven that only 1 to 3% of young to middle-aged cats get UTI. Another important initial test to do are x-rays of your cat's abdomen to make sure they don't have stones in their bladder or urethra. If your cat is older, such as more than 10 years of age, another good test would be an abdominal ultrasound to make sure there's no tumors in the bladder, and sometimes even a cystoscopy, which is a little camera that looks around the walls of the bladder. Once these causes have been ruled out, it can be assumed that your cat suffers from feline idiopathic cystitis. As we said before, it usually occurs in young to middle-aged cats, so usually up to 7 years old, and it occurs equally in males and females. However, males are more likely to get the more emergent form of this disease, or a urethral obstruction. Basically, they're unable to urinate, but we'll touch more on that later. The cause of FIC is not known. That's what idiopathic actually means. It means we don't know the cause, but it is thought to be due to an exaggerated stress response due to imbalances in their nervous and endocrine systems. This exaggerated response leads to inflammation in the bladder, and that inflammation causes the bladder to become leaky, and urine can then permeate into the deeper layers of the bladder. This leads to very painful urination, and then the cats associate this pain with the litter box and seek alternative places to urinate, so that's why they go outside the box sometimes. And interestingly, there's a very similar condition in women called interstitial cystitis. To manage FIC, attempts should be made to eliminate or at least reduce stress. When I tell this to my patients' owners, most people say, how can my cat possibly be stressed? He just lies around all day. But cats are creatures of habit, so any change in a daily routine can cause them to be stressed out. So things like moving to a different apartment, or something as simple as moving a piece of furniture can do it. It could be a stray cat outside that's upsetting your cat, or it could be something like working a few extra hours that week. All can be things that can stress out your cat. So another big stressor for cats is the litter box. So there should be, the number of litter boxes should equal the number of cats in your house plus 1. So in a 2-cat household, there should be 3 litter boxes. On a multi-level home, there should be a litter box on every floor. Most cats prefer clumping litter, so you can see which one your cat likes by making a little litter cafeteria, if you will. They like big litter boxes, so even as big as a storage container might be what your cat would like, especially for those big cats. And there should be no dead ends, so an exit at each point. And cleanliness is really important, so scooping every day and cleaning the whole box with soap and water once a month. If your cat does urinate outside the box, remember not to yell at them, because that can only worsen the problem as it adds to stress. Remember, they're not doing it to spite you, they just are in pain and think the litter box is a place of pain. So other ways to reduce stress: you should add a variety of upholstered perches throughout the house. Cats like vertical space, so cat trees. Pheromone therapy has anecdotally been shown to reduce stress. Fell-away is a synthetic version of the pheromone that cats secrete from their face when they feel calm and secure, and it comes in a diffuser and a spray. Looks like this. You should encourage hunting, chasing, and pouncing with toys and food puzzles. Your cat should have a safe place that provides them refuge from loud noises, visitors, and aggressive cats. If you do have a more aggressive or dominant cat in the house, you should put a bell on that one so the sensitive cat knows when that one's coming. So other things you can do to help with feline idiopathic cystitis is things with diet. Unless struvite crystals are proven to be a problem for your cat, such as if they have struvite stones or if they are blocked due to a struvite crystal plug, they don't necessarily need a prescription diet. The more important thing is just increasing water content in general. So if your cat eats dry food and they like canned food, potentially switching to an all-wet diet could be very helpful for them. And if you do this should be done gradually over 4 weeks. If they don't like wet food, you consider just adding water to the dry food if they'll still eat it like that. Other ways to increase water intake, you could add water sources on every floor. Some cats prefer running water over still water, so water fountains might help them drink more. And if it is proven that your cat does have struvites as the cause of their problem, then a prescription diet should be considered. You can talk to your veterinarian about it. Examples of this are Hill's CD and SO by Royal Canin. They can be fed long term. The most important thing to know about this disease is that if your cat is ever straining in the box and if you're not sure whether he or she is passing urine, you should take them to the vet immediately, because any part of the feline lower urinary tract disease, including feline idiopathic cystitis, can cause a urethral obstruction, so preventing them from urinating, which is a potentially fatal problem if not addressed quickly enough. Even if they are able to pass urinate, though, I do recommend bringing your cat to the vet because I'm sure they'd appreciate some pain medication. Thank you so much for your attention. If you have any additional questions about feline idiopathic cystitis or feline lower urinary tract disease, please feel free to contact Ocean County Veterinary Hospital to discuss it with any of our doctors. Thank you.